I am Dr. Dipankar Banerji from Jabalpur, Ideal Fertility and IVF Genetic Center, which is placed in MP, and I am a gynecologist. And there is a question regarding what is implantation bleeding, why does implantation bleeding occur, indication of implantation bleeding, what does implantation bleeding look like, how long does implantation bleeding last, can implantation bleeding be heavy, implantation bleeding or period. Is implantation bleeding a sign of early pregnancy loss? These questions are very important. And why there is implantation bleeding? Why? Because implantation means whenever there is a fertilization, either naturally where it is fertilized in outer part of the tube and gets implanted over here. Implantation means situating at the endometrium. Either it is naturally or we take out the egg outside and then fertilized it and then make an embryo and then do an embryo transfer. When it implants, when it gets, implantation has three phases: apposition, adhesion and invasion. This implantation makes, if I make it little bit bigger, then this implantation, this embryo goes inside the endometrium, that is the tissue of the mother. So when it goes inside, then it spreads its tissue to get food from mother. So it collects food from mother. For that, it starts sending its own blood vessels, its own blood supply to whole of the cavity, most of the time in the early part. Whenever this happens, the part of the blood vessels or part of the blood, this capillaries, which are present on the mouth of the cervix, that is lower part of the uterus, sometimes this dislodges and it creates bleeding. This bleeding is very common in natural pregnancy also, in IVF pregnancy also. You very well understand that naturally the pregnancy implantation takes place after ovulation 5 days, that is day 21 near about. In the same way in IVF also, we also plant this on day 21. So day 21 to day 30, that is the day of expected period. This thing happens. So at the time of expected period, the lady might have some bleeding at the time of expected period. This is called implantation bleeding. This implantation bleeding is very normal. But if it is heavy, like too big period, like you are consuming too many pads, then it becomes abnormal and then you should have an ultrasound. Because this thing usually go unnoticed and this grows very well. So implantation bleeding doesn't mean it is a period. Implantation bleeding doesn't mean that it is going to abort. Implantation bleeding is usually normal in natural and IVF pregnancies. So my answer is that implantation bleeding is sometimes, it is not a rule, but it happens in few pregnancies of IVF and in natural pregnancy. And it shows that at the time of expected period, some of the part of the blood from the embryo, it has percolated through vagina. And don't take it so seriously, so that some people might get very much disturbed. So it is a normal thing, and I wish that things goes normal and you have a natural and successful pregnancy. Thank you very much.